The rotator cuff is a common source of pain in many patients. And the best study to get a good anatomical look at the rotator cuff is an MRI. And so in this video, we're going to take a look at the rotator cuff and what it looks like on an actual MRI scan. When a patient presents to a physician with shoulder pain, a history and a physical exam are really critical when looking to determine the cause of that pain and help to guide further management and workup of that pain. In the right situation, an MRI scan might be ordered in order to get a good anatomical look at the rotator cuff. The rotator cuff can have lots of different problems that can be associated with it. You can have what's called tendinopathy, where you just get some fraying or wear and tear through the rotator cuff, or you can actually have tearing of the rotator cuff tendon off of the bone. In other situations, it's important to take a look at the muscle quality of the rotator cuff as well. An MRI is really best at looking at these particular situations more so than a regular X-ray. There are three main sequences on an MRI scan. And you can think of these sequences as sort of like perspectives, different perspectives when looking at the joint or the other anatomical structure. So in this first image, this is looking straight at the shoulder joint, and we refer to that as the coronal. And the second image, which is looking from the outer side of the shoulder looking in towards the shoulder, and that is referred to as the sagittal. And then finally, looking from top down, this is referred to as the axial view. All right, to help us understand how the normal rotator cuff looks like on an MRI, we need to do a review of the anatomy. So what I have here is a shoulder model, and this model includes the collarbone or the clavicle. This includes the shoulder blade, which goes all the way around like this. And part of the shoulder blade includes this back area called the spine of the scapula. And this spine extends over into this bony process called the acromion, which sort of overlies the arm bone right here. And so this acromion comes off the spine of the scapula and it acts as a sort of a roof above the arm bone here. And you can see the orientation of the acromion in this location. The other part of the scapula important to look at is this bone here called the coracoid process, and this is a little finger-like projection type of bone that acts as an attachment to ligaments and muscles. And then finally is the actual arm bone part, and this is a model of the ball part of the socket right here. This is actually the biceps, and the part of the biceps tendon runs up along the arm bone and dives into the shoulder joint, but we're not going to review that part today. And so we call it the rotator cuff because the rotator cuff muscles act as a cuff of tissue that surrounds the upper part of the arm bone. So you can see as I rotate around, the rotator cuff muscles surround the upper part of the arm bone in a cuff of tissue. And so there's four rotator cuff muscles. The first is right here in the front, so we're looking straight at the shoulder. The first is a subscapularis, so this is the muscle belly. It extends out towards the outer part of the shoulder and turns into a tendon and attaches to the front of the arm bone here. The second is called the supraspinatus, and this supraspinatus muscle attaches here at the sort of the top of the shoulder blade, so you can just see it just under here. It dives underneath all these ligaments and runs along the top and attaches to the top of the arm bone. If I pull the subscapularis tendon out of the way, we can see how that reveals the joint. And so I'll do my best to hold this model here for us. And you can see the socket right there, and then you can see how the supraspinatus muscle comes along the top and attaches right through here. And so this will be an important view because this will allow us to see what a coronal MRI looks like in just a second. So that's the supraspinatus muscle as it comes along the top of the ball part of the socket and attaches here. The third rotator cuff muscle is actually here in the back, and this is called the infraspinatus, and this starts as an attachment on the shoulder blade. It runs out towards the outer part of the shoulder, turns into a tendon, and attaches along the top and back part of the arm bone. And finally in the back here is a smaller muscle called the teres minor, and this attaches to the lower part of the ball of the humeral head. Okay, so to help understand the different viewpoints of an MRI, we need to go through the anatomy in each one of those perspectives. So if we're looking straight at the shoulder, this is called the coronal view. And the different views of the MRI allow us to see different parts of the rotator cuff a little bit better than others. And so on this view, the coronal view, we can actually see the supraspinatus better than the other rotator cuff muscles. And so if I pull the subscapularis tendon out of the way, we can see our ball, humeral head, articulating on the socket right here, the glenoid. And so we can see that pretty clearly. And then, let me get my biceps tendon out the way. And then we can see how the supraspinatus muscle, where it attaches along the top of the shoulder blade, and as it runs from this area laterally towards the outer part of the shoulder and attaches onto the greater tuberosity. So I'll bring that a little bit closer so we can see that orientation right there. So that's the supraspinatus tendon as it runs and attaches to the greater tuberosity. In this video, we're going to look at the axial view on the MRI, or the axial sequence. And as I rotate this around, you can see how the perspective changes on the model. And so this part in the front is the anterior aspect of the shoulder blade, and this in the back is the posterior aspect of the shoulder blade. We can see the humeral head right here, and as I retract the muscle out the way, and if I rotate the humeral head, we can see how it articulates and rotates within the socket, or the glenoid. The shoulder blade itself is in this location, and the front of the shoulder is here, the anterior part of the shoulder, and the back of the shoulder is here, the posterior aspect of the shoulder. The muscle along the anterior aspect of the shoulder blade is the subscapularis, and we can see where the muscle attaches, and then as it extends laterally towards the outer side of the shoulder, we can see how the subscapularis tendon attaches to the humeral head. The posterior aspect of the shoulder blade is the attachment point for the infraspinatus and the teres minor, and we can see those muscles, and those muscles and tendons extend out laterally towards the humeral head and attaches to the posterior aspect of the humeral head. This final sequence is called the sagittal view, and this is the view when looking directly into the side of the shoulder like this. And so to get a look at that, we'll rotate the shoulder blade like so. And if you notice, we can see the rotator cuff muscles coming out towards us, and here in the front as well. So this is the front of the shoulder, the anterior part of the shoulder, and this is the posterior aspect of the shoulder. The subscapularis is the muscle here in the front, and then the tendon extends out towards our camera right here. The supraspinatus attaches along the top of the shoulder blade and runs back out towards us, towards the camera, and attaches up in this location. The last two rotator cuff muscles attach along the back of the shoulder blade, right here, the infraspinatus and the teres minor. And these extend back out towards the camera again and attach along the top and sort of the back part of the shoulder for the infraspinatus, and the teres minor attaches more along the back of the arm bone. And so if we think about moving in towards deeper into the shoulder, we'll see the humerus here. And if we remove that, get that out the way, as we extend deeper into the shoulder, we can see now how it looks with the humeral head removed. And so we'll move all these muscles out the way. And so, here we go. I'm just going to fold this up out the way so we can see it nice and clearly. Here we go. So now we can see what it looks like looking directly at the glenoid, almost like you're looking down at a dinner plate. And so again, we can see the subscapularis along the anterior shoulder blade and the supraspinatus, the infraspinatus, and the teres minor along the top and the posterior aspect of the shoulder blade respectively. We can see the body of the scapula, the acromion, which is a part of the scapula as well, and the coracoid process along the anterior aspect of the shoulder blade. And so this will be a critical view when interpreting the sagittal MRI scan. Okay, we're going to start things off by looking straight at the shoulder, which is called the coronal view. And so I'll do a quick scroll through imaging. And so with each image, we're moving from front to back through this patient's shoulder. So each image is maybe a 3 or so millimeter slice through this particular patient's shoulder. So now that you see what that looks like, just cycling through the imaging, we'll start pointing a few things out. So we'll come to this image right here, and we'll see here this ball-shaped object. This is the humeral head, and this is the glenoid, which is the socket of the shoulder. So this is the ball, this is the socket. The rotator cuff on this orientation is the supraspinatus, and that's one of the 4 rotator cuff muscles. And so you'll see my cursor here. This gray is part of the muscle of that rotator cuff muscle, and as the muscle comes out towards the outer side of the shoulder, you see how it tapers down into this structure right here. And it attaches right onto the ball part of the socket. And this area is called the greater tuberosity. And this is the footprint. This area right here is the footprint of the rotator cuff. And by footprint we mean this is the attachment point of the rotator cuff, and it attaches over an area. And as I scroll through the imaging here, you can see still, once again, this gray muscle here. The gray muscle comes out towards the outer side of the shoulder, tapers down, and then attaches right here across this area, and then the tendons back up this way as well. So this whole structure is the rotator cuff tendon attachment on the arm bone right there. And so as we take different images, you can sort of follow that rotator cuff tendon as we move from front to back and back to front. And as you can see, we can go all the way to the back of the shoulder, and we can get a good look of the rotator cuff through the entire way of the shoulder. So on this view, we have what's called the axial view, which is looking from top down. And to help get you oriented, I'm going to move through the image. And you can see how we see a few structures right there. So let's come to about right here. And so this is our collarbone, the clavicle, and this is the outer part of our shoulder called the acromion, or the shoulder blade. So this is the acromion, which is part of the shoulder blade bone, and this is the spine of the scapula, which is just another part of the shoulder blade in general. So on this side is towards the patient's neck, and on this side is towards the patient's outer shoulder. And so by looking at that, we can orient ourselves. So we'll come deeper into the shoulder. Each image is getting deeper and deeper into the shoulder. And now we come to right here, where we can see the ball and the socket. So you really get an idea of how the shoulder joint behaves like almost like a golf ball on a golf tee. And so humeral head, glenoid, and then this orientation lets us look at a couple muscles in a little bit better perspective. And so this is the front of the shoulder, this is the back of the shoulder, and here's a muscle right on the front of the shoulder blade called the subscapularis. And we know it's sitting on the front because if we follow the glenoid, or the socket, and we follow this bony structure down, you can kind of see this, the cut of this particular MRI. You see a little bit of bone right here of the shoulder blade, and it's very thin. It actually is quite thin. And this muscle is on the front of that. You see how it's sitting on the front of this black line right here, which is the bone of the shoulder blade. And so here's that gray color, which represents the muscle. And then this muscle comes out towards the outer part of the shoulder. And you see how it starts turning a little bit darker, and that's where it turns into the tendon. And then it swings towards the front of the ball, the humeral head, and attaches right up to the muscle right here along this area, this footprint. And so that's the rotator cuff tendon of the subscapularis. And in the back of the shoulder, it's a little hard to see, but you see another gray muscle in this area. And this extends out towards the outer part of the shoulder, and then this also attaches to the ball part of the socket. And this is probably the infraspinatus or the teres minor, which are some of the muscles towards the back of the shoulder. And you can tell how we have muscles pulling this way and muscles pulling that way. Essentially, we have muscles pulling from the front and from the back, and that helps seat the golf ball on the golf tee and helps provide stability to the shoulder. So in this view, we're looking from the side of the patient in towards their shoulder. So we're not looking directly from the front, and we're not looking from top down. We're looking from the side in towards the shoulder. And so we'll take a few images here, go through a few images. You can see how the perspective on the shoulder changes now. And so this is called the sagittal view. And so we'll start on the outside of the shoulder here. And this is looking at the deltoid muscle. And as we go further back into the, or as we go further into the shoulder, you'll see the arm bone come into view right here. You can see this arm bone right here. And this bone right here is called the acromion, so that's part of the shoulder blade. And so we'll keep going further into the shoulder. And here we're getting part of the collarbone and then part of the shoulder blade bone called the acromion. And then we're starting to see this smaller bone called the coracoid process. And so as we keep going deeper and deeper in there, now we're looking at the socket, sort of like we're looking top down onto a plate, like a dinner plate. And so this is the socket, this is the coracoid process, this is part of the collarbone, and this is part of the shoulder blade called the spine of the scapula. As we go further into the shoulder, you'll start to see the cut through the shoulder blade. So I know this looks a little funny, but this is the spine of the scapula, this is part of the scapular body, and this is the part of the coracoid process. And we can sort of make out the four muscles of the rotator cuff here. So this first muscle right here, that's the supraspinatus. This muscle right here is called the infraspinatus. And this one in the front of the shoulder is called the subscapularis, and then the teres minor is down here and hard to see. And so as we scroll through that, we'll come back out towards the outer part of the shoulder, and you can sort of make out the four muscles of the rotator cuff, the muscles and the tendons, a little bit better now. So we have the subscapularis here in the front. Up here we have the beginnings of the tendon of the supraspinatus. We have the infraspinatus, and then we have the teres minor, and those are the four muscles of the rotator cuff. So you can see as I go back and forth through, we can follow each of those muscles as they come outward onto the arm bone right here. So you can see how that tendon comes down and attaches to the arm bone right here. This is definitely one of the harder views to understand just from the perspective of things. So this is a little bit different sagittal view, a different type of MRI scan, and it helps us see the four rotator cuff muscles a little bit better than the previous MRI. And so again, we're on the sagittal view, we're looking in towards the shoulder. Here's the glenoid or the socket and the coracoid process. And as I scroll through right here, you can make out the four rotator cuff muscles. So here's the front of the shoulder, here's the back of the shoulder, and this top muscle is the supraspinatus. This muscle here in the back is the infraspinatus, and this muscle here is the teres minor. And this muscle here in the front is the subscapularis. So that makes up the four rotator cuff muscles of the shoulder. And so as we head back out towards the outer part of the shoulder, we can follow each one of those muscles as they turn into their respective tendons. So we'll stop right here. And so again, here's the supraspinatus, infraspinatus, teres minor, and subscapularis. And if you see these darker areas within each of those muscle units, that's where the tendon fibers themselves are starting to form. And so we'll come a little bit further out towards the outer side of the shoulder, and you can see how each of those tendons attaches to the arm bone right there. So again, let's take a look. Subscapularis, tendon fibers, supraspinatus tendon, infraspinatus tendon, teres minor, and just watch each one of these as we scroll back out towards the outer part of the shoulder. And we can see how those approach the arm bone, and then how each one of those attach right to the arm bone. Again, subscapularis, supraspinatus, infraspinatus, and teres minor, and then they attach right there. So in summary, shoulder pain is often caused by rotator cuff problems, and those problems can vary from just some wear and tear to complete tearing of the rotator cuff tendon off the bone. And the MRI usually, for the most part, is the best study to get a good detailed anatomical look of the rotator cuff, which really helps physicians and surgeons come up with an appropriate treatment plan for their patients.